in another case that you had shared, Grahadantapara Taila and Kutaja Taila both are constant, but some herbs keep on changing, and this is causing a little bit of confusion in the minds of the other practitioners. Like, oh, how do you formulate? Meaning, how do you choose which one to use where? Sir.
See, definitely when we see the patient, whether the patient is a Medasvi patient, whether patient is thin in body nature, whether patient is suffering from this condition for a quite long time, whether intense itching is there, whether oozing is there, whether peeling is there. So based on those characters, see if there is a oozing, then definitely it is involvement of Pitta as well as Kapha. So then we need to go for using particularly Gandhaka Rasayana is to be added there. And many a times I go through the history when I take the history from them. If they have a tendency of consuming water or very less water, or they are having consuming many other things, then I need to control them or check them. So for that purpose, I use Charmamrita powder. It is one of my combination which contains Sariva, Manjista, and Khadira, Ushira, and Haridra and Triphala in that. So that containing powder, I ask them to just take it to 2 spoons in 2 liters of water, boil it well, and then filter it. Then after filtering, use that liquid for entire day for the purpose of drinking. Don't drink any other water. You drink only this water throughout the day. So when I make them to drink this throughout the day, definitely it will help in cleansing their blood, and from there and it becomes to make it totally alkaline, and our body systems gets thoroughly cleaned. So that is the reason I go for with that. So it depends on typically the depending on the patient needs and as well as the condition demands. Based on the condition, if it is severe itching is there, then I concentrate on that itching part to reduce it. If it is oozing is a more thing or peeling is a more thing, then accordingly. So here and there, that slight and mild changes or understandings of adding Gandhaka Rasayana or adding Charmamrita or deleting it, it will be there. Otherwise, it will be around these things. There are few kashayas like Mahatikta Kashaya, Pitarachakvata, Manjishadi Kashaya, then Aragvadadi Kashaya, Gugurtita Kashaya. These are some of the important Kashayas are there. Around this only it will evolve. And among the capsules, of course, Panchatikta Gurta is there directly, or even I can go for the Pro Skin. And then for a dry thing, I'll go for many times a detox capsule is there, and otherwise there is a combination of Soharb is there. Then application is, of course, quite commonly I'll go for these type of psoriasis or Ekakusta or Kitipa Kusta, these type of cases. Mahamanjista, the containing Vinsoria oil is there, or otherwise Kutajataila is there, or Bradantapala is there. So it's a combination of these things only. We need to just to understand, or we need to just to concentrate on these drugs only. These are quite efficiently, they have been designed and they are being used. And I am also quite confidently using them in many cases and finding a result. So that's why I depend on those drugs.
To sum it up, probably it is safe to say that external application is for maintaining the to get rid of itching and scaling and the skin pigmentation and whatnot. So that is covered. So internally, whatever we give is one is say Rakta Shodhana, and straight away which are Kushtahara or which are explained exclusively for skin, and which are say in the form of Virechana to be done, like bowel cleansing, largely bitter and Tikta group of herbs like Panchatikta Gruta or Proskin. So most of your prescriptions would revolve under these principles. If I'm missing, can you please add anything, sir?
Definitely. See, but the first thing is when Ayurveda is very clearly says about that anything which is produced in these type of chronic disorders, they are basically produced from the gut. So gut cleansing is a must. So in order to go for a Virechana, classical Virechana and all those things, patient may not be convinced many a times, maybe having some constraint of the finances and many other even time and so many things. So they'll straight away agree for a simple way of Nityame Virechana or just simple bowel cleansing every day. That will be beneficial for them also and even for the practice. So I opt go for that. Usually I don't go for the classical way of Panchakarma doing Virechana and all those things, because many times patient may not be having sufficient money to resource to make the things to be done in that direction. So second thing is, once we do the cleansing of the bowels in a proper manner and we have made a restriction on a diet, very clearly the rasa and rakta getting dushana will be stopped. So once that is there, so we are somewhere put a break on the samprapti which is continuously happening. Then afterwards, what the drugs we are using, they're also avoiding the kavai gunya, they're also avoiding the cleansing the doshas, clearing the things, and automatically things will set right and the lakshanas will subside. So that's the reason Ayurveda has very clearly stated that we need to go for a cleansing from the bowel and then start introducing the drugs, so that definitely it will be helpful.